Hey guys, I'm going to go ahead and record your topics that we would be going over this week in community. So this will be chapters 16 and 17. So we'll go ahead and talk about that right now. And just make sure that you watch both of these this week. And also, I will send you those practice questions that go along with these chapters, just like I have been. So I'll do that after I record this. So watch for those in your email. And then also make sure you go onto your Canvas for community this week and do your discussion question. So I have it due Wednesday. So I want you to do it, so I can count your attendance for this week. So please make sure you go do that. It's just a case study with I think 3 questions, so nothing crazy. All right, let me see if I can share the screen here. All right, so like I said, this is just chapter 16 and 17. So this is changing health behavior using health education with individuals, families, and groups. So a major goal of healthcare reform is to reduce costs. One way to do this is to help people stay healthy and to reduce illness and disability. Nurses can play a key role in the aspect of healthcare reform by teaching individuals, families, groups, and communities how to promote better health. So some of the things that we go over in this chapter would be ways in which people learn, things that you can guide you with community health education, stuff like that. Okay, so issues in public health nursing. So with health education, this guy named Wes, he says, first I went into nursing, I had no idea I'd end up spending most of my time teaching patients, but I find that I'm good at it and I enjoy it. Teaching specific patient groups requires a lot more than delivering data. You have to really understand where your patient population is coming from. I enjoy that challenge. So Healthy People 2020 talks about health education. So a sample of objectives for health education for that would be this. They say they want to increase the proportion of elementary, middle, and senior high schools that provide comprehensive school health education to prevent health problems in the following areas. So things like unintentional injury, violence, suicide, tobacco use and addiction, alcohol or other drug use, unintended pregnancy, HIV and AIDS, and STDs, unhealthy dietary patterns, and inadequate physical activity. So nursing steps to develop a community-based health education program would be this. So you identify this population that has this specific need, you select one or more of these learning theories to use, and then consider which educational principle is most likely to increase their learning. Examine educational issues, identify anything that might be a barrier to learning, and choose the most appropriate teaching and learning strategies. Design and implement the educational program, and then evaluate the effects of the educational program. A couple other things that they talk about in Healthy People 2020. Another one is increase the proportion of college and university students who receive the information from their institution on each of the priority health risk behavior areas listed above. Increase the proportion of work sites that offer a comprehensive employee health promotion program to their employees. Increase the proportion of local health departments that have established culturally appropriate and linguistically competent community health promotion and disease prevention programs. Okay, so remember these 3 things. So the easiest thing to change is knowledge. Changing attitudes would be the next step, which that's a little bit more difficult. The most difficult thing to change is behavior. The difference between education and learning. So education is an activity that's undertaken or initiated by one or more agents, and it's designed to affect changes in knowledge, skill, and attitudes of individuals, groups, or communities. Education is I just said that. Education emphasizes the provider of knowledge and skills. In contrast, learning, when you're talking about that, it emphasizes the recipient of knowledge and skills and the person in whom a change is expected to occur. Learning involves change. To change means to move away from one way of thinking, believing, and acting and moving towards a new way. So it is, kind of a difficult thing to get someone to change their attitudes and behaviors about something and then get them to change to do something else. So Thompson's steps to understanding and managing organizational change are this. Identify the need for change and means that the clients being served need to believe and they need to make a change. Plan how to implement the change, and this step includes explaining the basis for the change, the benefits of the change, and seeking ideas from those being served about the best way to make the change. Implement, so do whatever it is you're deciding to change, and then evaluate whether the change has made a difference in health. There's this guy Fielding who also offered another approach with this. So he says, he has 5 steps in his plan. He says, understand the problem, understand what works, agree on the approach of action, and then implement the plan and evaluate the effect. Okay, which one of these is the hardest thing to change? Remember, we said C, behavior. And then this is just a review of what we've just talked about already. Okay, when we talk about how people learn, what a person hears is filtered through his or her past experiences, the social groups to which the person belongs, their assumptions, their level of attention and knowledge, and the esteem with which he or she holds the person that's communicating the information. So again, learners accept information based on what they already know, what they believe, kind of how their culture has shaped them, and then how well they understand and how well they relate to the information. So it's important to keep 3 education principles in mind when planning any community seminar. That guy West that we were talking about a few minutes ago, he says you want to think about the nature of learning, the educational process, and then the skills of effective educators. A variety of educational principles can be used to guide the selection of health information for individuals, families, communities, and populations. 3 of the most useful categories of educational principles include those associated with the nature of learning, the educational process, and the skills of effective educators. Okay, so this is talking about ways that people learn. So there's these 3 domains of learning. We've got cognitive, that deals with how you're thinking. Affective, it deals with feelings. And then psychomotor is how you act. So each domain has behavioral components that form a hierarchy of steps and levels. Each level builds on the previous one, and it talks about, at the bottom, motivating adult learners to learn. So adults are motivated to learn when they think they need to know something, the new information is compatible with their prior life experiences, they value the person providing the information, they believe they can make any necessary changes that are implied by the new information. Okay, so this talks about the cognitive domain. So this includes memory, recognition, reasoning, understanding, application, and problem solving. Hierarchical classification of behaviors, like if you're trying to teach someone about something, you kind of, you start low with, some of these things, like maybe you just get them to memorize something. Then, as you keep going, you're building on all of these things. So the cognitive domain consists of these components. Knowledge, this is, it requires recall of information. So, that's kind of our basis of where we're starting at. Then we want to make sure that once someone gets the knowledge, that they can comprehend it. So comprehension, this is where you combine recall and understanding. Then you build on that and you move on to application. So now you know the information and you take it in and you use it in a different way. And then you could move on to analysis. Analysis breaks down communication into parts to understand both the parts and their relationships to one another. So again, that's a little bit deeper thinking. And then synthesis builds on the first four levels of assembling them into a new whole. And then the highest level one would be evaluation. This is where learners judge the value of what has been learned. Okay, and then when we talk about effective learning, like cognitive learning, consists of a series of steps that a learner takes. These steps are as follows. You first get the basic knowledge, so you receive whatever the information is. The second one, you comprehend, so you respond to the information that you received. 3 is application. So again, you assign value to the information that you learned. Analysis is making sense of the information. Synthesis is organizing the information that you've got. And then evaluation is adopting behaviors consistent with new values. So again, effective is all about like how your feelings and stuff. So if you have, like if you're trying to teach someone something under the affective domain, you try to essentially, like at the highest level, change, their values or their behaviors. So on the slide here, it says nurses' attitudes and values can differ. It's difficult to change deeply rooted attitudes, beliefs, interests, and values. So there's really 6 steps to change. So you receive, you respond, you assign value to what you learned, you analyze, you synthesize, and then you adopt whatever the new thing is. The next area that we're going over is psychomotor domain. So this is more like hands-on type learning. So you use neuromuscular coordination and motor skills during this. First, you would have to demonstrate whatever the thing is that you're trying to teach. Then you have that person practice it. So in a classroom environment, learners can benefit from observing one another. So think about like when you guys are in lab, when you do lab, that's kind of how that works. It's more hands-on, you're doing things. So psychomotor learning depends on learners meeting the following 3 conditions. So the learner must have the necessary ability. This will include both cognitive and psychomotor ability. For example, you may find that a person with Alzheimer's disease can follow only one-step instructions. Thus, you need to tailor your education plan to that person. The learner must have a sensory image of how to carry out the skill. For example, when teaching a group of women how to cook in a more heart-healthy manner, ask the women to describe their kitchen and how they would actually go about the cooking process. The learner must have opportunities to practice the new skills. Provide practice sessions during the program to help the patient adopt the skill in his or her home or work environment where the skill will be performed. Okay, the educational process builds on an understanding of education, learning, and how people learn. The 5 steps of the educational process are: you identify whatever the need is, you establish educational goals and objectives, you select appropriate educational methods, you implement the educational plan, and you evaluate the educational process. And then you decide what you would do next from there. Okay, so when you're trying to figure out what someone's educational needs are, you need to do a needs assessment. So the needs assessment, you identify what the client wants to know. You then collect the data systematically about their learning needs, their readiness to learn, and barriers to learning. You analyze the assessment data that has been collected and identify cognitive, affective, and psychomotor learning needs. You think about what will increase the client's ability and motivation to learn, and then you assist the client to prioritize learning needs. All right, so you want to match that person's strengths to whatever their need is. You want to provide variety in what you're teaching. So maybe not only do something where you're talking to them, but also show something visually. Incorporate new forms of information. So you could use social media or something along those lines because that's very popular now. Consider age, gender, culture, sensory abilities, knowledge level, and the size of the group. Okay, so if you're going to be an effective educator, you need to gain the learner's attention. You need to make sure you go over what your objectives are, ask the learner to recall prior learning, present essential material, help the learners apply information, and then invite learners to demonstrate the learning and then provide feedback. All right, there's also something called motivational interviewing. This is a term that can change the talk to refer to statements by clients that are motivated and willing to make change. It's a partnership between the teacher and the learner. So they make their own choices, and there's 4 essential stages in this motivational interviewing. You have engaging, empathetic listening, guiding, and planning. Motivational interviewing related counseling sessions. So there's this mnemonic here, it's OARS. So O stands for open-ended questions, A stands for affirmations, R stands for reflections, and S stands for summary. Okay, so when you want to develop an effective health education program, you need to have a clear message, you need to have a non-distracting environment, you need to be clear in what you're saying in your language, and then you need to have a tailored learning format. Okay, so then educational issues that you might need to think about. There are 3 important educational issues to consider when you're planning educational programs. First, different populations of learners require different teaching strategies. Population considerations are based on age, culture, and ethnic backgrounds. Second, be prepared to overcome barriers to learning. Third, consider the appropriateness of using technology in the programs. And then population considerations, you want to think about pediology. So this is learning strategies for children and individuals with little knowledge about a health-related topic. And then there's a term called andrology. This is learning strategies for adults, older adults, and individuals with some health-related knowledge about a topic. And then there's also cultural specific factors. By 2050, 50% of the US population will consist of ethnic minorities. So cultural competence is essential in presenting written, audio, or visual information. Technologies may enable the learner to do the following. So you can control the pace of the instruction, you can offer flexibility in the time and location of the learning, you can present an appealing form of education, provide immediate feedback. And there's a variety of different technological things that you could do to help, assist in the learning process. You want to make sure you use the internet appropriately and evaluate the quality and reliability of internet sources. That's kind of a big deal because a lot of people don't understand how to judge what's a reliable source to look at. Educating people through the internet has been shown to be more effective in fostering treatment adherence than in-person counseling, telephone counseling, or self-directed learning. However, it's essential to evaluate the quality and reliability of internet sources. The following list provides some criteria for assessing the quality of internet health information. Authorship. Are the authors and contributors listed with their credentials and affiliations? Caveats. Does the site clarify if its function is to provide information or to market products? Content. Is information accurate and complete? Is it appropriate? Is there a disclaimer provided? Credibility. Does the site include source, currency, relevance, and editorial review process? Currency. Are dates listed for when the content was posted and updated? Design. Is the site accessible, internally searchable, easy to navigate, and logically organized? Disclosure. Is the user informed about the purpose of the site and about any profiling or collection of information associated with using the site? Interactivity. Does the site include feedback mechanisms and opportunities for users to exchange information? Disclosure. Is the user informed about the purpose of the site and about any profiling or collection of information associated with using the site? Have links been evaluated according to backlink linkages, content, and selection? Does the site include feedback mechanisms and opportunities for users to exchange information? All right, and then when we talk about barriers to learning, so there are some educator-related barriers. Those would be fear of public speaking, which is a big one for a lot of people, lack of credibility with respect to a certain topic, limited professional experiences related to a health topic, unable to deal with difficult people, lack of knowledge about how to gain participation, lack of experience in timing a presentation, uncertain about how to adjust instruction, uncomfortable when learners ask questions, and you want to obtain feedback from learners, and maybe you're concerned that media, materials, and facilities will function properly. And then you might be overly dependent on your notes. All right, when we talk about evaluating the educational process, feedback to the educator provides an opportunity for the educator to modify the teaching process and enables the educator to better meet the learner's needs. Process evaluation examines the dynamic components of the educational program. It follows and assesses the movements and management of information transfer and attempts to make sure that the objectives are being met. All right, so when we talk about the educational product, the outcome of the educational process, it can be measured quantitatively and qualitatively. So qualitatively is how well does the learner appear to understand the content. Quantitatively would be how much of the content does the learner retain. There's a variety of approaches, methods, and tools that can be used to evaluate health and behavioral changes. So there's questionnaires, there's rating scales, surveys, checklists, skills demonstrations, testing, subjective patient feedback, direct observation of improvements in patient mastery of materials. Evaluation of outcomes measures includes changes in knowledge, skills, ability, attitudes, behavior, health status, and quality of life. So nurses often provide health education to groups. People live in a social structure that may include family, coworkers, classmates, friends, and acquaintances. Health behavior is influenced by the groups to which people belong, and groups may support either beneficial or poor health practices. Groups are an effective and powerful medium to initiate and implement changes for individuals, families, organizations, and the community. Community groups may be formal or informal. Formal groups have a defined membership and a specific purpose. They may or may not have an official place in the community's organization. Informal groups, the ties between members are multiple, and the purposes are unwritten yet understood by members. These groups often form spontaneously when participants have a common interest or good or need, excuse me. A group is a collection of interacting individuals who have a common purpose, cohesion, you want to have cohesion in a group, is the attraction between individual members and between each member in the group. Individuals in a highly cohesive group identify themselves as a unit. They work toward common goals, they endure frustration for the sake of the group, and defend the group against outside criticism. A task function is anything a member does that deliberately contributes to the group's purpose. Members with task-directed abilities become more attractive to the group. These traits include strong problem-solving skills, access to material resources, and skills in directing. Of equal importance are abilities to affirm and support individuals in the group. These functions are called maintenance functions because they help other members stay with the group and feel accepted. Other maintenance functions are the ability to help people resolve conflicts and create social and environmental comfort. Both task and maintenance functions are necessary for group progress. Norms. These are standards that guide, control, and regulate individuals and communities. The task norm is the commitment to return to central goals of the group. The strength of the task norm determines the group's ability to adhere to its work. Maintenance norms create group pressures to affirm members and maintain their comfort. Reality norms exist when members reinforce to challenge and correct their ideas of what is real. Group, task maintenance, and reality norms combine to form a group culture. The role structure of a group refers to the expected ways in which members behave towards one another. All right, and then there's these different stages of group development. So specifically in the forming stage, members become acquainted with one another and the leader. They become oriented to the group and try to determine what their behavior should be in relation to one another and the group as a whole. Excuse me. In the storming stage, members begin to express their own individuality, which may run counter to that of others, and they often express hostility to one another and polarize due to impersonal issues. In the third or norming stage, members start to accept one another. They develop some cohesion, norms, and roles, and become comfortable in expressing their opinions and offering ideas. Members begin to trust one another, and their interaction takes on more depth. In the fourth stage, performing, the group uses its interpersonal structure to accomplish its goals, and the group energy is directed towards the tasks. In the fifth stage, adjourning, the group engages in separating from one another. All right, when you choose groups for health change, how might a nurse help establish groups to work toward community goals? So you're going to build cohesion through clarifying goals and individual attraction to groups. You're going to build member commitment and participation. You're going to keep the group focused on the goal, maintain members through recognition and encouragement, maintain members' self-esteem during conflict and confrontation, analyze forces affecting the movement towards the goal, and evaluate the progress. All right, so when you're managing the community group, you want to begin work on your stated purpose and help the members interact. Pay attention to who's attending, who's eliciting information, clarifying, and recognizing contributions of other members. It's normal to have conflict, so members can feel obstructed or irritated by others, In groups, members may express frustrations about trust, closeness, separation, dependence, and independence. Acknowledge conflict and work toward problem solving while respecting all members. All right, and then you want to implement the educational plan, the control over starting, sustaining, and stopping each method and strategy in the most effective and appropriate time and manner. Coordination and control of environmental factors, the flow of the presentation, and other contributory facets of the program. Keeping the materials logically related to the core theme and overall program goals. And then back to this guy, Wes. He says, do I have one thing I wish I could tell new public health nurses about teaching? Sure, it's just this. Teaching specific patient groups is not just about what they need to know, it's also about what do they think they need. After all, it doesn't matter how through your teaching or how thorough your teaching is. If you aren't in tune with your audience's concerns, you're not really going to reach them. All right, so that was chapter 16. Let me see if I can get the other one up real quick. All right, so chapter 17 is building a culture of health through community health promotion. So in here, some of the objectives are we're describing a culture of health and community health promotion in the context of the ecological model and social determinants of health. We are analyzing participatory approaches and the interrelationships among communities, populations, and interprofessional healthcare providers in the application of health promotion strategies. We're describing evidence-based practice using the integrative model of community health promotion. And then we're also analyzing nursing and interprofessional roles that are essential to build a culture of health through community health promotion. Okay, so back in 2013, the Robert Wood Johnson Foundation kind of defined this culture of health. They said, where good health flourishes across geographic, demographic, and social sectors, where being healthy and staying healthy is an esteemed social value, and everyone has access to affordable, quality health care. So when you think back historically about health and health promotion, Florence Nightingale comes into mind, way back, because back in the Crimean War, she volunteered and helped, take care of soldiers, and she kind of figured it out that sanitation and infection control were like really important. So she kind of started all of that out. Then you look at the holistic view based on ancient Greeks' view of health. Then there's a couple other things they mentioned. Lalonde in 1974 identified 4 major determinants of health: human biology, environment, lifestyle, and healthcare. And then in 1977, Bronfenbrenner, they came up with the eco-social perspective, describing human environment interaction and health outcomes over their lifespan. And then, of course, more modern day, we have Healthy People 2020 and, 2010, 2030, whatever. Okay, which is one of the Lalonde's 4 major determinants? The answer is the environment, A. Okay, so with definitions of health, the World Health Organization has their definition. And then in 1981, Smith had a different idea of what health was. And then we need to define what population health is. So definitions of health promotion. So Leavell and Clark in 1965 had these levels of health promotion. They talked about primary, secondary, and tertiary. And then the World Health Organization kind of also talked about health promotion in 2014 and kind of updated what they said. And then Klubok in 1997, Laffrey, Loveland, Cherry, and Winkler in 1986 described 2 perspectives: a disease-oriented, and a health-oriented perspective. So emphasis on community as target of practice has gained attention since the mid-1970s. The US government, Canadian government, and private health researchers attributed declining mortality and morbidity rates to better standards of living. Healthy People in Healthy Communities, a community planning guide based on Healthy People 2010, also kind of played a part here. Okay, so the National Prevention Strategy, published through the US Surgeon General's Office by the National Prevention Council in 2011, seeks to improve the health and quality of life for individuals, families, and communities by moving the nation from a focus on sickness and disease to one based on prevention and wellness. To realize the vision for children, youth, adults, and the elderly, the National Prevention Strategy targets interventions in multiple settings. These include healthy and safe community environments, clinical and community preventative services, empowered people, and elimination of health disparities. The idea that the health of communities and populations is shaped by multiple determinants has been reinforced in the national and international health policy literature. The current focus is on determinants of population health, which include genes and biology, health behaviors, medical care, total ecology, and social and societal characteristics. In the figure above, genes, biology, and health behavioral choices account for 25% of the population health and social determinants of health, including medical care and the physical, social environment account for the remaining 75%. Nurses have long recognized the importance of an emphasis on wellness and health promotion in healthcare. In public health nursing practice, it's abundantly clear that many factors beyond illness have the health or affect the health of individuals, community, and populations. Studies show that there's no better way to promote health and improve quality of life of individuals than through basic healthy habits, like exercising regularly, maintaining a balanced and healthy diet, developing a positive and optimistic outlook, and refraining from smoking. Important goals are directing healthcare toward helping communities and populations to identify their health potential and providing care and resources that move communities and populations towards their health potential. These actions serve to improve the health of the overall population and decrease the burden of disease in vulnerable populations at the fringe of healthcare. Although theoretical frameworks developed within nursing and other health disciplines are traditionally oriented towards individuals, there is increasing recognition of the importance of community and person-environment interactions that goes beyond social cognitive theory and other interpersonal frameworks in promoting health. So on this particular slide here, it talks about the community as a client. Anderson and McFarland, they came up with a community as partner model. It has 8 major community subsystems. Back in 1993, and then I guess they updated it in 2009, Salmon, they came up with the model that embraces multiple determinants of health. It's consistent with the perspective put forth by the Institute of Medicine on population health. And then Keller did that intervention wheel that we looked at before. Okay, so this is just a huge list of different models and frameworks of, the same stuff. So we've got the Framingham Heart Study, the Stanford 5-City Project, the Minnesota Heart Health Program. These are all examples. Okay, the health promotion models and frameworks. So the National Cancer Institute's theory at a glance identified 3 levels of models and frameworks. So there's individual health promotion models. So you got the health belief model. You've got interpersonal health promotion models, social cognitive theory, and then community health promotion models, which is social ecological model. So which model is used for interpersonal health promotion? This is going to be B, social cognitive theory. And again, this is just reviewing what we talked about already. So individual health promotion models, that would be health belief model. Interpersonal is the social cognitive theory, and then community would be social ecological model. Okay, the ecological approach to community health promotion. So nurses have long recognized the importance of an emphasis on wellness and health promotion in healthcare. In public health nursing practice, it's abundantly clear that many factors beyond illness affect the health of individuals, communities, and populations. And I think we've said this on the previous slide before. So again, if you can improve someone's quality of life by exercising regularly, maintaining a good diet, and all that stuff, that's definitely going to help with this. Okay, so an integrative model for community health promotion. So important assumptions underlying the model include the need for integration of care in the complex healthcare system, the inseparable nature of individuals, families, aggregates, and community systems, and the maximization of health potential through the health promotion interventions. In addition, the model builds upon complementary health and disease perspectives. On this slide, it talks about continuity of care at multiple levels. This helps nurses to describe their own areas of expertise within the complex healthcare system. It provides a basis for collaboration and partnerships among nurses and other healthcare providers and the population. Okay, with each ecological perspectives on population health. Lifestyle improvements efforts have typically focused on the individual. However, from a public health perspective, you want to focus on the bigger group, right? So there are internal and external determinants and society determinants. So down at the bottom here, it says, for instance, adolescent decisions not to smoke are associated with their individual attributes, positive self-image and that kind of thing. Family characteristics, aggregate characteristics, and community factors. As a result, interventions to initiate or maintain healthy behaviors have greater potential for success when directed systematically toward multiple targets of the individual, family, group, community, and society. So if they use an ecological approach to the community health promotion. All right, social determinants of health. So Farley and Cohen in 2005 introduced the curve shifting principle. This principle complements the ecological model and calls for targeting health interventions at the population level. They build on the representations of the relationship between individual and group behavior, with individual behavior being the foundation of the total population distribution. Farley and Cohen in 2005 introduced we just said that. So anyway, this also talks about assessments and interventions in the curve shifting principle. It's, built on the environment it's talking about. All right, then when we talk about an integrative model for community health promotion. So the important assumption underlying the model includes the need for integration of care in the complex healthcare system, the inseparable nature of individuals, families, aggregates, and the community, and maximization of health potential through health promotion interventions. In addition, the model builds upon complementary health and disease perspectives. All right, and then there's an interprofessional application to nursing and public health. So there's a community-based participation research that you could do. There's photo voice methods and projects that you could do. And then there's community-based participatory research, like I was just saying, so go into more detail about that. This is a philosophical and theoretical basis for partnerships and collaboration. It's used for ecologic and community and environmental assessments. And partnerships are active, so community members are involved in assessing, planning, implementing, and evaluating change. So examples of community-based participatory research would be things like healthy eating and exercising to reduce diabetes, physical activity and neighborhood resources in high school girls study. Those would be some examples. Then we talked about that photo voice method. So here's some more details about that. So this process prevents written text from hindering communication and is it's effective in a society that utilizes oral tradition to preserve its culture. This can be used as an assessment tool. So this integrates the strengths of social support and engagement. It builds local capacity to identify and address community concerns. So it allows participants to photograph, contemplate, and verbalize stories or simple descriptions about their photos taken in response to a particular prompt. All right, and then with the application of the integrative model for community health promotion. So they talk about obesity and the built environment. So they say the remaining slides present some examples of the integrative model to help the reader to apply these concepts. So, all right, so the people we're talking about, the client system would be individual, family, aggregate, and community. And the focus of the care would be illness care, illness and disease prevention, and then health promotion. So when we talk about illness care, this is teaching the patient about the effects and side effects of their medications, how to monitor their weight, nutrition, and physical activity at home. If you're talking about the family, they may be predisposed to genetic problems. They need to watch their lifestyle and environmental factors related to obesity, give family members information about their illness, including early recognition signs and symptoms. And then if you're talking about the aggregates, you're going to assess the prevalence of obesity among high-risk aggregates in the community and teach obesity prevention and treatment classes, for the community. With the community, you're assessing whether there are adequate and available providers and resources for healthy food and also safe physical activity in the community. With illness prevention, for individuals, we want to teach measures like healthy nutrition, progressive exercise, and lifestyle techniques to prevent additional weight gain. With a family, we want to teach healthy nutrition and regular moderate to vigorous exercise. With the aggregates, providing showers at workplaces to encourage exercise before and during the workday. Oh, showers, I said showers, that's funny. And then community. So year-long multimedia campaigns to provide intensive community education to prevent obesity. And then with health promotion. So if you're talking about individuals, encourage them to adopt a health promoting lifestyle and help them to become aware of their own power to do so. If you're talking about families, encourage families to make health promoting activities a part of their daily lives, which might include taking walks, swimming together, or joining an intergenerational baseball or bowling team in which families compete with other families. If you're talking about aggregates, teach heart-healthy classes or activities that are culturally specific to particular subgroups, like older Hispanic women or African-American teenage girls. And then with community, you're participating in a coalition to plan for supermarkets and parks or recreation areas within the community that are safe and accessible to the population. Okay, guys, so that is the topics for this week, for week 8. I'll have other stuff on for next week, for week 9, so make sure you come back on and check and watch those as well. Thanks. I hope you guys have a good rest of the week.